So as mentioned, I'm TJ Farrell. I am the Assistant Head of Creative Spaces at the Marriott Library. And under normal circumstances, I help students, faculty, and staff learn how to 3D print designs that they might have made. So as the pandemic shut down campus, we started thinking about ways that we might utilize resources on campus that were otherwise going to be shut down to lend some assistance. So initially, it was a lot of kind of just work to create the right connections between people, find out what resources were available, and how we could participate in a way that was helpful and not harmful. There were a lot of different kind of ideas bouncing around, and we wanted to make sure that we contributed in a way that was responsive to the needs of our local healthcare providers. So to that end, one of the first things we accomplished was to reach out to different departments that had resources like a laser cutter that's necessary for cutting face shields, reaching out to hospital administration to see what the needs were, connecting with healthcare providers in order to really assess and to listen to what their needs were, and then to really work forward on projects based on those responses. So one of the things Brendan Patterson was able to help us with very early on was to create a Slack channel that really connected a lot of voices, whether it was student designers, administrators, healthcare providers, library workers, just to really tie all those voices together so we could have a clear way to communicate. And another component was just connecting with the community response. So the two images that are on display here, we have the Lasan Studios make space. So this would normally be full of students using different types of equipment. There's a shop in there, but you can see on the table there is a stack of clear acrylic face shields. So those were components that were used in one of our projects. And then on the right, you have a very messy 3D printing space. This was probably in early April, and it's a little cleaner today, but not much. So figuring out what designs, who was participating, and how we could align resources to really be effective here was one of our early efforts. So in the next slide, we show, I believe this is a slide of the Salt Lake County, if you want to forward the presentation there. So the community response that we got was pretty significant. A lot of people reached out to us early in this process to ask how they could participate. A lot of people said, I have a printer at home, I can make things. How can I participate? So having a channel to communicate with our community users was essential. And to that end, again, Brandon stepped up and coordinated a community response. The Salt Lake County libraries contacted us relatively early on and said, hey, we have all of these printers that we're actually not using. They're just in storage, and we'd like to contribute those to your effort. So we were able to coordinate a drop-off with the Salt Lake County Libraries team and really add to the fleet there. So that was very helpful. And then in the next slide, we show a couple of, so there's a stack of face shields. These are staged to go out. So this is kind of in the post-production stage. But then on the right, you can see this is how we coordinated drop-offs. So once a week, Brandon would send out a message to people saying, here's the design that we'd like. We need X number of these. We'll do drop-offs at this time on this day. And so we would put out bins, people would drop things off, we would bring them in, quarantine them for a while, and then they would go out for assembly. So another component was we had employees from the Marriott Library would pick up these kits and they would take them home. So in the next slide, you'll see 3 of our dedicated assembly team. And this is where they would take the kits that included a laser cut component, the 3D printed components, some of which were sourced from the community, and then an elastic component that would be assembled and then sent back to the library, and then we would collect those and distribute them for donation. So yeah, the project involved really lots of people from different parts of campus, multiple libraries, even throughout the valley, just coordinating a lot of different efforts there. So,
and TJ, just to provide some numbers, so we did have over 90 volunteers throughout the community donate over 700 face shield parts, and it was really an effort by people from, like you mentioned, from campus, but also those from neighboring libraries, and it was really neat to see some of those, and we have highlighted some of those volunteers via the Marriott Library's blog. Some of them were able to share pictures of their experiences at home. And I think it's worth noting too that this wasn't unique to the Marriott Library. There were libraries throughout the country that were producing PPE for hospitals. We're lucky enough to have a hospital directly associated with the university, so we were able to work very closely with them. Other libraries maybe had to source it out through community members or other ways. But it was really interesting to have this national conversation about libraries' ways of supporting this huge effort and kind of stepping up to do that. So I really think TJ did a great job of being kind of the person on the ground, kind of doing a lot of this effort. So
it's been a lot of fun working with such a large team. One of the benefits we had throughout this was also the Center for Medical Innovation, which is a lab that produces medical grade equipment here on campus. And so in addition to the face shields, which were kind of the lower hanging fruit that we could make, we worked with the CMI to make several different revisions. So you can see in this picture, there's me and Jared Smith from the Center for Medical Innovation working on a PAPR hood project. So a PAPR hood is a powered air purifying respirator. And I'll show a little more of these designs in a quick demo here in a moment. But being able to, get the protective equipment that we were making in the library was really just face shields. We tried out a few different respirator mask designs and didn't really find anything that we really loved. But being able to make these powered air purifiers, really, I'm still printing these components today. The printers are all running, just making boxes that kind of house the motor and connect to a filter.
And the Center of Medical Innovation is housed in the basement of the Eccles Health Sciences Library, and we're located right next to the School of Medicine, so it's very convenient in terms of having that access to the hospital. And our whole basement right now is basically a production facility. I mean, you go downstairs and you see these boxes everywhere, you see tables set up. So it's quite the effort, and it's been a really integral part now of the process of keeping people safe while working with this deadly virus. So
yeah, it's been really nice to have that as a conduit, right? So I mean, I'm only printing a handful of parts, and then they get assembled. So it's nice to have a role to play in all of this. So I think now we're hoping to transition to just a quick demo. I can show, if I may, a couple of the designs that we've been working on. So let's see. All right, so this is the face shield that you've all seen. So just three or four components, some of which are printed. And then the other components we've been making are these. So this is a 3D printed motor enclosure. So there's three parts here. There's a handful of other parts that attach to a hose. So a hose comes out here. The filters go on, and the finished product looks exactly like this. So it's got a belt that wraps around with a powered, so a battery hooks up here, and then air is blown out here that's filtered through here. So, and again, the work that I'm doing is really just printing these parts. There's so much that happens after this. Parts are, everything has to be tested. And so working with a lab that can really perform that testing, do the validation studies, has been very helpful throughout all of this. And it's allowed us to kind of go through a lot of different prototypes and iterate things relatively quickly. You've probably seen masks like these that a lot of, they have gotten some pickup, but working with the hospital, we printed a lot of these and sent them up to the hospital in their fit testing labs and their air purifying testing chambers and that kind of thing. And even these, so this is a design that's based on a 3D scan of my face, and so it's relatively time intensive to create one of these, and it fits really well to my face. It conforms exactly, but when I talk, it still breaks that seal. So there's that. I do have one final one that I really enjoyed though. So this is just a test. So it is a 3D scan. And then it's got a filter material here that was just a testing material with a band. This didn't pan out, but my favorite part is that it sounds like a kazoo when I talk with it on, because it's got this this filter on here. So it sounds like a kazoo, and if I were to sing, it would be really beautiful. So that's all. So a couple of different projects. There was quite a bit of kind of exploration involved. Working with a really large team, and it's been a great project.
Well, thanks for demoing those, TJ. I know that the engineering department also was really interested in some of the designs, and we also had faculty from the design major on campus through the fine arts department. And all those communications were happening via Slack. So there was a community that was forming at the university, and is currently still there, that kind of discusses a lot of these situations and would talk about, well, what are ways that we can, even beyond just the making process, what are ways that we can sanitize these things, or what are ways we can make sure that we can use less of it. So kind of having some of these ventilators and things, or the machines outside of the rooms themselves, so those people could maintain that social distancing, was something that was talked about during this pandemic via the Slack channel. And also the hospital, we had some vital members of the hospital that were also a part of those discussions, so making sure that they can kind of give what their highest needs were. So we weren't just creating things just to create them. We were really addressing those needs that were most needed at the time.
I would also encourage anyone to check out the timeline. Just if you go to the library's website, which is shown here, we have a PPE production timeline that kind of documents this process as well.